are talking, our presenters, but we're not going to record the actual screening. So if you want to catch the Power to Heal, you need to stay with us for the middle of the event. Okay, and with that, I would like to invite Reverend Eleanor to help us open a sacred space.
Hi, everyone. It's great to be here, and I want to invite you to just take a second. I need to switch my view so that I'm not just looking at myself. Great. Take a second to do whatever you need to do, and then come on back. Since we're here, we're in so many different places. I want to say good evening and good afternoon. And as we fully arrive, let's remember to just take some deep breaths, put down whatever we might have in our hands, and come together in spite of the distractions of the day and the place, and be together. And pay attention for a moment to our bodies as we become a little more still. Let's remember that our bodies, our health, makes our whole life possible. Whether we're feeling really fit or whether we have aches and pains, everything that happens because of our bodies and our health, everything that happens to us. And our bodies are sacred, are connected to the whole universe, and created to exist in this universe in harmony, through breathing, through touch, through water, through fire and earth. Our bodies need care and attention, and that rolls right up faster than we want to admit into healthcare and healthcare policy and all the big problems and big challenges alongside and enclosing the smaller, the individual, the private struggles that we have with our own healthcare, with the healthcare of our loved ones. So I'm going to light the chalice in that spirit of connection. Where did I put it? The flame of truth in the cup of love. Thank you. Pablo, do I keep talking here?
No, that's okay. If you're done, if you have other things you want to say, you have a minute or so.
The faith grounding and the framing. Two things I wanted to mention. One, our Unitarian Universalist Association has regularly passed healthcare resolutions at least 10 times over the course of the existence of our denomination currently. And in particular, there's one from 1992 on universal healthcare that I would urge you to look up. It's quite beautiful, eloquent, and in keeping not only with our existing principles, but also with our future proposed principles, I felt when I read it. The other thing I want to say is that as a healthcare chaplain and a minister and a Unitarian Universalist, when I worked in a nursing home as a chaplain, I was chronically angry, chronically challenged, just confronting the existing severe healthcare disparities and the problem of the for-profit system continuing to govern and pressure many, if not all, either indirectly or directly, our healthcare institutions. And it was such an opportunity for me to get to draw you into this film, because it gave me the opportunity to remember that when I stand on this hill and look out at all the problems, I am not standing all alone, and I am not standing on something that others did not create before me. The despair that I face has been faced before. The challenges that I see are only possible for me to see because of the work that others before me have done, and because of the shoulders that all of us stand on in getting to where we are right now. So I want to thank everyone for coming, and I want to thank our presenters, and I look forward to this film.
Thank you so much, Reverend Eleanor. So now I'm just going to quickly sort of preview the evening for you. We heard from Reverend Eleanor. You heard me asking folks to control your microphones and mind your video feeds. I've asked everyone to do that typical UU roll call, put into the chat your name, your church, your state, your congregation, land acknowledgement, your preferred pronouns, typical stuff for UUs. Then we're going to hear from Dr. Barbara about the film. She's going to set it up for us, and then we're going to watch the film together. We're not going to record the screening of the film in deference and respect to Dr. Barbara's work product. When we're done, we're going to resume recording, and we're going to have a conversation with Dr. Barbara about her journey making the film. And then we're going to transition to conversation with Brittany and Rebecca from Public Citizen and North Carolina Justice about what Medicare looks like today. So that's the basic agenda for the evening. And with that, I'm going to be happy to introduce Dr. Barbara.
Hi.
So I was just going to say that Dr. Barbara is the project creator and producer. She's emeritus at the City University of New York School of Public Health and a distinguished scholar in public health, environmental justice, and the US healthcare system. And she has been telling folks across the country that she was inspired to create and produce the Power to Heal, Medicare and the Civil Rights Revolution by the compelling stories of her colleague, Dr. Richard Smith, who was director of field operations for hospital desegregation in 1966. So with that, I'm just going to allow and invite Dr. Barbara to set up the film for us.
Hi. First, well, as you heard, my name is Barbara Berney, and I am the producer of this film. And I first want to tell you that I'm really glad that you were able to come tonight and that you decided to watch the film. I think that it's a really important part of our history that many of us, including me, didn't know until I came to make the film. And I think it's really important to know that Medicare is the reason that we have desegregated hospitals, and that it didn't just happen. And I think that it's important to think about the fact that, you know, even though many of us knew that there was lots of segregation before it was made illegal in 1965, that we don't think very much about the fact that our healthcare system, our hospitals and doctors' offices, et cetera, were all segregated. And that Medicare, because it said to people, if you want our money, then you have to follow our rules. And one of our rules is that you desegregate. That this is one of the reasons that hospitals are currently desegregated. And one of the most desegregated areas in our economy. So I think that's also important to remember. As you watch the movie, I think that it's important to think about the fact that the community played a really important role in desegregation, that this is not something that was done by individuals or even single organizations, that it was really a community effort. Now, having said that, I think it's also important to note that doctors and dentists played an active role both in the desegregation in hospitals and in leading their local civil rights movements. And they and also other people in the community were always looking for the next opportunity to move the struggle forward. And that's really important. And I think that's really important for us to remember today, that you always have to look for the next opportunity and that people never gave up. And with that, I think we should watch the movie.
Amen to that, sister. Thank you. So now, Paulette, would you please cue the film and stop the recording?
That I came to make this film because my colleague Dick Smith told me this story about how he was sent to Marshall, Texas, and he arrives there. And I didn't know this at the time, but he was the head, as you were told, he was the head of field operations for Medicare. And of course, the president did not want any hospitals in Texas, and certainly not in Marshall, Texas, which was Lady Bird's hometown, to fail to desegregate because it would have been extremely embarrassing. So Dick Smith was sent there, and he calls the hospital administrator and he says, "Hello, I'm Dr. Smith, and I'd like to help you desegregate your hospital. Is there sometime that we can meet?" Well, the hospital administrator says to him, "No." And I heard this part of the story and I was just totally astonished. And then the hospital administrator calls the president. And I never heard this part of the story, but he gets through. And he says, "Why, Mr. President, you didn't mean for us to desegregate our hospital." And the president laughs. And he says, "Why, yes, I did. And Lady Bird and I are coming down for a wedding on Thursday, and maybe you could do it by then." Well, I was just amazed by this story. And I thought, well, obviously, I can't be the only person who's never heard this. And I thought, well, this is a story that has to be told. And it has to be told not just to your best friends who will read it in a journal article. It has to be told in a film so that many, many people can find out. And that's how I came to make the film. Now, I learned a great deal in making this film. And it reiterated and reminded me of how hard it was to be a person of color and become a doctor or a nurse or any other kind of clinician. And it reminded me of what you had to put up with to do that. I mean, many nurses told me, of the horrible experiences of racism and discrimination that they put up with, both from patients and from superiors and from people who were teaching their nursing classes. And they just said, well, I had kids and I, needed the job. And so I put up with it. And I think that the important thing that we should remember is that, of course, people put up with it because they didn't have any choice. It wasn't like there was somebody you could report this to who would listen to you and respond. So I think that making the film reminded me of the constant pressure of racism and discrimination and the assumption of power and superiority by white people, many white people. I wanted to remind you also that the way to get the film, if you want to show it to some other group of people, is to get in touch with me at I put it in the chat, hospdeseg, HOSPDESEG at gmail.com, and tell me just who you're wanting to show it to and what your situation is, and I'll do my best to get it out to you. And I want to hand the forum back to Pablo, and I'll be happy to answer any questions that you might have.
Right. Paulette, can you add me to the spotlight? I don't seem to have that control, but I just want to create some space just very briefly for folks to ask Barbara, Dr. Barbara Berney, some questions about the film or about the process of making the film. And then we want to go into the presentation for our from our Medicare activists and advocates. So do we have any questions from the field? If so, I would ask you to please raise your electronic hand. That's in the reaction button at the bottom of your screen. If we don't have any questions, then we will move on. Any questions? There we go. Gina's gets the prize for being brave. There you go, Gina.
I don't really have a question, but I don't see it in the chat. Your email, could you repeat it just one more time?
I'll put it in the chat again.
Okay, thank you.
And we will also send it as part of our follow-up to this event. So you'll get it in an email.
Great. Thanks. Great film. Thank you very much.
Any other questions about the film or making the film, or a comment about the film? I'll share the, oh, here we go. D Chavez. Go for it, D. Unmute yourself and ask a question.
Hi. I was wondering if we who are activists in the Medicare for All movement, to create universal, excuse me, single payer healthcare, can we learn anything from this? What Johnson and many of the activists did in that time to bring about what we're trying to bring about, which is to have fairness and equality for everybody. Equality of access to healthcare.
Dr. Barbara, do you have opinions about that?
Well, I think that certainly it was hugely helpful to have the federal government on our side in working to desegregate the hospitals and to have a lot of money. I mean, this was, for a lot of hospitals, this was 25% of their funds, and they couldn't afford to say no. They needed that money, and they needed that money now, and they were faced with a situation where that if they were really discriminating, then they were likely never to get the money. And even if they were going to get the money, they were going to have to wait a long time, right? They were going to have to wait until the adjudication process was over. So, here we are today, and I don't think that we're in a position where we can count on the federal government to help us out. And I think that the most important message from this film is that we have to organize, and we have to see if there are things that we can do that will get us closer both to equity and to universal health care. And I'm hoping that the speakers who come after me will talk about what's being done now and the current efforts to achieve that. I know that National Nurses United is running a big campaign for universal health care, and in many states there are statewide organizations. And I think that this is really important, and that we have to look, that the most important message of the film is that we have to look for opportunities to move this struggle forward.
Thank you.
I want to underscore, it's absolutely helpful to have the federal government on your side. That's one of the reasons that UUSJ engages with federal policy, right? Because it has the potential, actually both positively and negatively, to really catalyze systemic transformation. And so one of the reasons that we conceive of what we do as a federal ministry is precisely because we're trying to push the federal system into making and catalyzing positive change. And we try to interrupt the interlocking injustices within federal policy wherever we encounter them. And that's one of the, and for that reason, we're very interested in root causes. So it's been a pleasure to see the film. It's been a pleasure to get to know Dr. Barbara. I see Wendy has raised her hand. Let's call this the last question, and then we'll move on to hearing about Medicare today. Wendy.
Yes, I defer my question to V Nelson 3 at nycrr.com. She's been raising her hand on the camera rather than with the application of Zoom now.
Great. That's very nice of you, Wendy. Would said person please speak your...
Miss Nelson, you need to unmute your Zoom. There you go.
Thank you. That was very kind of you, Wendy. Thank you so much. I just want to say how much I appreciate this film. And I want you to know, in my community, especially the older people in my community, the last thing they want to do is go to the hospital. And unfortunately, that has caused so many deaths that were not necessary. Because in my community, going to the hospital is like going to your death, because of the treatment that we have received in the past. And it's so wonderful for people to learn about their history. I know in my family, my aunts and my older people, it was the last thing that they did. And then when they got to the hospital, they did expire. Thank you very, very, very much for this film.
Thank you.
Thank you.
And with that, I'm going to ask that Paulette assist me in adding Rebecca and then Brittany to the panel. I'm looking for Brittany. Brittany, maybe you can raise your hand so I can find you and we can add you. There you go. Okay. Awesome. Thank you so much. So I want to take this moment to introduce our next two speakers. Rebecca Cerese is a social justice activist, an award-winning documentary filmmaker, and a passionate healthcare advocate. And I want us all to celebrate with Rebecca. She just won the Families USA Health Advocate of the Year Award for health coverage and health care work. That's what a great and special honor it is to have her with us this evening. Rebecca's the health policy advocate at the North Carolina Justice Center, working with coalition partners and community members around the state to promote better healthcare policies for all of North Carolinians. In that role, Rebecca partners with people who have been directly impacted by our dysfunctional healthcare system to amplify their stories and fight for policy changes. We're also going to be joined by Brittany Shannahan, who works as an organizer for Public Citizens Medicare-for-All Campaign. The primary focus is working with activist groups around the country to pass municipal resolutions in support of Medicare for All, and using the resolution's strategy to build stronger activist networks and social movement infrastructure at the regional, state, and national level. So prior to her time with Public Citizen, Brittany worked as a staff organizer for Medicare for All with Healthcare as a Human Right, Maryland, and organized grassroots efforts on climate change, energy poverty, and student debt in the US as well as the UK. She currently lives in Baltimore. So with that, I just want to invite first Rebecca to give us a sense of what's on the ground today. You know, I was extremely pleased when you made yourself known to us and allowed us to recruit you for this role. If for no other reason than North Carolina was right at the heart of some of this stuff. Right there in below the Mason-Dixon line, in the Bible Belt, in the Sun Belt, what we call the Sun Belt today. So to the extent that you can, would you give us a sense of what things are like today, how much has changed, what needs to continue to change, and help us put some real concrete sense of what's going on into the conversation. Thank you so much, Rebecca.
Absolutely. Thank you so much for that lovely shout out. Just really wonderful to be here. What an inspiring and incredible film. And you're right, North Carolina did have a huge role to play, and tomorrow is February 1st, and the sit-ins, happen on February 1. That was the first documentary that I ever got a chance to work on. And so inspiring. There's so much we can learn from these movements, just ordinary folks doing extraordinary things to move us closer to the promise of what America can be and should be. Imagine a society where we take care of our people. We're very unfortunately far from that, although we are making strides. So North Carolina did just expand Medicaid, and that was a long time coming, 10 years delayed doing that. And I think a lot of it is tied together with racism, which, is unfortunately a theme that is woven into our country. It's at the core of it. It was brought up, it was looked at so brilliantly in the film. I think that Medicaid, the delay was because it was in a piece of legislation that was promoted by the first Black president. And I also think that, we unfortunately in this country don't want to have nice things if it means that we all get to share them together because of the woven in racism. So there's a lot going on there. Unfortunately, health disparities still exist. They're massive. We saw this with COVID, with the people who disproportionately got sicker or died from COVID. We see it in childbirth, maternal health, infant health, so many issues. And again, the expansion of Medicaid is definitely going to expand health coverage to 600,000 people in the state. It still leaves too many people unprotected, too many people uncovered. We have a for-profit healthcare system in this country that does not put patient care at the center. They put profit at the center. And until we can actually address that and transform our system away from that, unfortunately, people are going to be, continuing to get sicker and sicker unnecessarily. They're going to continue to face, massive mounting medical bills, even if they have insurance. But again, there's lots that we can learn. One of the things that we can learn is very much like what we learned in the film. There's ways to think about what is the moment we're in right now? What are the strategies that we can put forward? I mean, I'll be honest, when I first started as the health policy advocate at the Justice Center, I did not think we would actually be able to get Medicaid expansion passed for so many reasons. And yet, with the help of so many people on this call, the UU community in North Carolina in particular, just amazing partners showing up all the time, we created a grassroots movement that really changed the conversation about what was happening with Medicaid not being expanded, who was suffering, how real human beings were impacted. And we were able to change the conversation that was going on, and it created it opened up oxygen to change the way things were done. The federal government played a role. We actually organized with the 8 southern states that had an expanded Medicaid, and we got a financial incentive put in the American Rescue Plan. So all the states that had not yet expanded Medicaid would actually have a financial incentive to do so. And it worked. It worked for North Carolina, not when it first happened, but that definitely became a factor. So it's an inside-outside game. It's about being strategic. It's about pivoting. I really, really do believe that it is possible. I'll just quickly go to Medicare now. So the issue with Medicare is it's a wonderful program, and it was even better before private health insurance companies took over administering at least half of these plans. And what ends up happening then, of course, is profit becomes the centerpiece instead of patient care. Medicare itself really needs to be improved and expanded. Right now, it only covers 80% of the cost for most people, unless you have a Medigap plan or a Medicare Advantage plan. It doesn't cover vision, hearing, or dental. It doesn't cover anyone under 65 unless there's a disability. So there's a lot of, doesn't allow for, well, now we are allowing it finally to negotiate for drug prices, because we know prescription drugs is another thing. So there are ways that we can right now work to improve Medicare, bringing up issues with people in a way as we're working towards the big picture of transforming our system. Unfortunately, I don't think we're there right now, but I think there are wins that we can have as we move towards that. And some of those are the things that I just mentioned. We can work on improving Medicare. We can work on expanding Medicare. We can work on reining in the privatization of Medicare and in turn Medicaid. And these are things that we are going to be difficult too, but we can win on, and that will bring us closer to where we need to be. And I'll stop there because I want Brittany to have a chance to talk about her amazing organizing efforts.
But before we do that, Rebecca, just follow me out a little bit on the ledge here.
Okay.
To the extent that you're representing a southeastern state, you work in the southeast, and to the extent that the heart of PowerToHeal is talking about the intransigence in the southeast. Based on your interaction with other organizers in different states, Mississippi, Texas, Florida, South Carolina, et cetera, to what extent do you think your experience in North Carolina is characteristic of the region?
I think it's very characteristic. I mean, there's a reason that out of the 10 states, that haven't expanded, now 7 of them are in the South. We still have the racism. We still have, unfortunately, a political party that is in control of those states that doesn't look out for people. It doesn't actually want to expand government services to cover people. You know, they'll come at us with the socialism term and things like this. I think one of the things that is going to help us, though, is that unfortunately I mean, and this isn't a good thing, unfortunately, but I think our healthcare system is on the brink of collapse. It's just, it's not working, and it's getting worse and worse and worse. And it's not just like at one of the levels, it's at every level. So hospital systems with the mergers and like just taking things over, private insurance, which keeps, you know, making people less and less insured. We have this, you know, pandemic of basically underinsured people. So people that are carrying around an insurance card but can't actually afford to use it because they can't afford the deductibles or the premiums or the copays or whatever. We have the drug companies, like I said. So it's like at every level, the greed and the corporate greed that's putting profits over people is destroying our system. And unfortunately everyone has been impacted by it, because we're all going to get sick or have an accident, or someone we love will at some point. And so this is something that everyone is feeling, everyone is experiencing, and I just feel that there's been a tide change. And what our job is as organizers, as people that care about this issue, is educate ourselves about why what we're trying to push is better for people, and then be ready for that opportunity, because the opportunity is going to come. And I mean, like, you know, who knows about what would have happened, but if President Kennedy wasn't killed, right, would there have been the space opened up for Lyndon Johnson, a Southerner of all people, to come in and pass like the Civil Rights Act and the Voting Rights Act and, you know, the Medicare Act? It's like, but those opportunities did present themselves. The right things ended up coming into place, strategy, you know, and it happened. And that's the thing. We need to be prepared, because I think that that moment, our window, is going to open up sooner rather than later. And we just need to be ready with real solutions. Unfortunately, I'll say one last thing. Unfortunately, the powers that be, the moneyed interests, the special interests, corporate power, is more entrenched than ever before. You know, the AMA was the bad guy, right? And back then, and they were standing, and they still are standing in the way of like a single payer system. But now you have so many more special interests that are spending billions of dollars on, you know, I call it legalized bribery, you know, lobbying and commercials and all of these things to propagandize people into saying we don't want something that is going to give them more choice, that's going to cost us less, that's going to promote better health care for everybody, you know. And that's why it's so important that we think strategically about how we talk about things, how we present our information, and how we organize.
Thank you so much, Rebecca. Brittany, you play in this area across the entire country, not just in the Southeast. You talk with organizers and activists, lay leaders like the ones that you have on this call, about these issues on a regular basis. So I'd ask you to characterize the conversation about Medicare across the country, and then give us you know, to the best of your ability, a state of play on where you think we need to go above and beyond what Rebecca shared with us. I will just say that, you know, I'll disclose, I used to work for a governor, and one of my tasks was to work hand in glove with the Medicare and Medicaid director. So I have a deep interest in this, and I'll just say that I think I agree that the corporate pressure is absolutely immense, but I also think, based on the data that I saw, the user, you know, figures that I saw, that we do have to make sure that whatever system we implement keeps people responsible to some degree for themselves. Like, we can't have them have no ownership, no participation in the process. They have to have some version of skin in the game. So Just a side comment, before Brittany takes the, the stage. Brittany, go for it.
Sure. Excuse me. So always excited to share any space with Rebecca and hear what she's been up to. Also great to see Barbara. I've been personally using this video a lot as an organizing strategy for years. I think, there is, in our different social movements, there is a history of sort of, our movements being very white led and thinking about a universal experience of healthcare being the white person's experience of healthcare. And this movie has been a really good way to sort of contextualize things correctly. And it's been an educational resource for a lot of people. So I really appreciate that. So I thought I'd give some observations as like a social movement person, kind of drawing also on, we are in a big social movement moment in this country right now, right? It's a huge movement for social movements. It's what some people might call a takeoff moment. And this film is also about a takeoff moment. And so like, as an organizer, part of my job is to try and get things ready, kind of as Rebecca was talking about, for the takeoff moment, right? You got to create the infrastructure so that the ducks are in a row. And, so like one thing, like looking at this film, noting the unity of movements and the crossroads of movements as well that happened here. You've got the civil rights movement, but then the anti-war movement comes in. And that this diversity where it's like, this is the thing about the takeoff moment, is that there's so many different groups getting involved that it's an ecosystem in itself, right? And these are really big components to look for. And another thing to point out is just to not, kind of also what Rebecca was alluding to, is to not wait for the right president to start getting involved. There is an accident of history here, but also just the way that an issue like Medicare for All, the way we understand it, is very shaped by a press that has never been good at covering social movements. In the history of this country, we have never had a press that could understand, or that wanted to understand, or tried to make people understand social movements. And that's another thing we're going through right now in this big social movement moment, as well as the press has struggled to understand that. And so what the press often does is it boils things down to presidential races. And so the conversation about Medicare for All has often been about whether or not Berney's running. And then it's like, oh, then we talk about it. But that's not how a movement works, right? Is you build, and then you have a takeoff moment. And so don't let like the story of Johnson and his accomplishments think we don't have a Johnson, therefore we shouldn't organize. Another thing I wanted to just sort of add in there is just the presence of unions in this movement, which is very interesting and a little uncomfortable, in that like unions wanted plans for retirees because retirees were expensive to care for, to have insurance for, right? And that was a part of how Medicare was planned the way it was. And there's also just this, it is also okay, so what's the most expensive group of people to care for? Seniors. So it's, despite the difficulties with the hospitals themselves, for the insurance industry, this is not such a bad thing, right? And another thing is just to point out is like how, like the way that unions, especially unions, pressed it to be this way, because they felt we negotiated our plans. The retirees, that's the problem. That's when people get sick. That's when they need government care. Is that this did, this tied health insurance to the nuclear family. It meant that people in feminized jobs and racialized jobs, if that's the right word, were worse off because, say that you worked as a seamstress or as a housekeeper and your husband worked as a day laborer. That's not a union job. There's no insurance, right? And so there's also this history with the development of Medicare over the years, of politicians asking, so what is the private sector willing to put up with? And we've learned through history that that's not a good thing, is that we don't want to ask that question anymore. And I bring up the unions also because this is something that comes up, is people always say, well, what about the unions? The answer is, if you're in one, to organize it. So like one good example, hopefully got the, oh, I don't have it. I don't have the link, but if you look up, so the New York City retired workers recently got a big victory where they've been fighting the city that has been trying to put them onto Medicare Advantage plans, onto privatized plans. And they've been fighting it for a while. They came down to DC, like 60 of them this summer. We walked around the offices, the congressional offices for these visits, and they won. Just this group took on the city government that was like, we want to put you on this privatized plan because your plan is too expensive. And they were even fighting their own union. And so again, if you're in a union, organize. But sort of outside of all that, my work. So like with Medicare for All, you've got two bills. You've got HR 3421, the House bill, and then S 1655, which is the Senate bill. And as has been said, it's not going to pass this year, but what we're doing is we're building a social movement infrastructure. And so my work has mainly been around passing Medicare for All resolutions in city councils. So I'll put that. And I think Rebecca passed one as well. So just putting that, the link in the chat. So we've passed like maybe around 130 resolutions around the country. And the point is that Medicare for All is a federal bill, and it's very hard to organize local coalitions around a federal bill because people who are disenfranchised don't feel like calling a senator is going to work, right? And so, and the other, another thing going on here is that people who sit on city councils go to run for higher office someday. And so you're building the next generation of members of Congress, of senators, possibly a president, who will pass Medicare for All in the future. And then it's also, you're running a local campaign. This is getting people to get the skills that they need to organize locally. And that's what I mean by movement infrastructure. It's just the types of just organizing practices, habits that people develop by working together, relationships that can be counted on in years to come. Again, that's something that's going on right now. With the big movement going around right now, is people calling up people they haven't spoken to in 10 years, right? They're like, and they're working together again. So yeah, like, so the if you're interested in passing a resolution, it's pretty simple. I mean, most city councils in decent large size cities tend to be Democrat. And we have a toolkit on the website, Medicare-for-All-Resolutions.org. And we've got step-by-step guide there. You can sign up or you can reach out to me. But yeah, I'll stop it there because there may be some questions.
Can I just add one quick thing to just piggybacking off Brittany? There are national organizations like National Nurses United, which you mentioned, PNHP, Physicians for National Health Program. Of course, Public Citizen is doing work. Social Security Works is doing work. There's just a lot of groups that are healthcare now. And then there's local, there's state organizations or coalitions. We have North Carolina Medicare for All Coalition. We're trying to, use the power of numbers, right, of people to sort of push our elected officials, our people running for Congress to support certain things. And of course, the big goal is to get them to support a Medicare for All plan. But leading up to that, how can we get them to move away from this privatization of Medicare? Because again, we're actually going in the wrong direction right now. We're actually pushing toward a program that was a public program that had a 2 to 3% overhead, and now half of seniors get their plans through this privatized scheme that's defrauding people, that's leading to delays and denials. We're going in the wrong direction. So something we can do that we could potentially win on the road to Medicare for All is stop these Medicare Advantage plans. And that was what a lot of these groups are now shifting to, which is very exciting. It's more winnable. It's less of a heavy lift. And then it can help us build our momentum to actually take on the whole system.
We have several people on stack, and I want to recognize and give some space for questions. We're running short on time, but let's start with Bill, who has been waiting patiently to ask his question since Dr. Barber was speaking. Bill C.
Thank you, Pablo. So my question is for Rebecca. There seems to be a turning point in my particular observation that really just happened last calendar year and is still momentum. And what I'm referring to is the number of medical institutions that are flat out saying they're not renewing Medicare Advantage. If you're following this in the news as closely as an advocate or an activist, that number is growing and growing and growing, especially with the news this week on Humana. Can you comment on that?
Absolutely. Excellent observation. Exactly. These plans are so bad in their reimbursement and their timeliness and the onerousness of the paperwork and bureaucracy that big institutions, many hospital systems are no longer taking them. At the same time, in the Senate right now, the health insurance companies are pushing what we call a Medicare Advantage love letter. They want people to sign this to say how wonderful Medicare Advantage is, and they had one in both the House and the Senate for years, but last year they didn't have enough signatories in the House to actually put one out. So what we have been doing at the Medicare for All Coalition is taking this moment to meet with our senators and representatives to be pushing phone calls and emails to them and their staff, in particular in the Senate, because that's where the love letter is going around, to say, don't sign on to this. Here are the problems with Medicare Advantage. They're defrauding people. They're actually delaying and denying care. Like traditional Medicare doesn't have massive prior authorizations for things, and yet we're now making seniors do this. You know, and this is a great opportunity. So we need to look for opportunities like this to organize around, and then to prepare to try and chip away at this proliferation of the privatization of Medicare right under our noses. And you're right, the proof is there. They're not better. It's not a better way to administer the program. And in fact, it's actually catching a lot of seniors off guard and leaving them unprotected.
Next, Gina.
Yes, thank you very much, both of you, for the work you're doing. It's fascinating. I live in central coast of California, and we have a terrible shortage of medical practitioners. This has not affected me on Medicare because Medicare is the best insurance I've ever had, mostly because I'm paying through the nose for my supplement and I don't need referrals. And I think that is the single most positive nature of Medicare. My question, though, is what is your understanding and opinion of the impact that our completely dysfunctional immigration system is having and is going to have? Now, here in California, we fought for over, I think, 10 years to get Medicaid for all, Medi-Cal, we call it here, but it's Medicaid. We finally got the young kids, we got the old people, and now we have the undocumented fully covered by Medi-Cal. So whether this is going to bankrupt the state, I don't know, but we have immigrants coming into so many different states, and they need health care. So do you have any perception of how that is impacting some of your work, either of you? Thank you.
So it's not necessarily impacting my work. I mean, I don't know if there's, I don't know how to say this, like, in many cases, immigrants are doing jobs that were maybe was done by a different ethnic group before. And so whoever was doing those jobs before would still have healthcare needs. I think the main thing, so Medicare for All would cover everyone. It would cover everyone regardless of immigration status. And I think that is very important because in Canada, it doesn't. And that is a problem. That, you know, there's people who are undocumented in Canada and they don't get health care and they're especially vulnerable. I think that, you know, one of the things, and kind of going back to what I was talking about, the union situation where unions were like, supported this idea that people who had worked and retired were the ones deserving of health care. I think it's just important to move to a point where we're thinking of healthcare as just a basic need rather than something that we sort of think about certain people needing more of or less of, because, you know, sometimes we get into this point in the single payer movement where we find ourselves advocating for how much money we're going to save. And it's true, we are going to save a lot of money, but at the same time, from my perspective, if somebody's disabled, if somebody has a rare genetic condition, I don't want their care to be cut, right? And that is what the system does right now. It does do that right now. And so, yeah, I'm just wary to answer too many questions about cost directly, because so often, so as Americans, the way that we're taught to think about costs and things like this means to sort of like pretend that the ethical considerations that have to go into how we decide on something like the delivery of healthcare, that they can be somehow made neutral and flattened when we talk about costs, but that's a political discussion. And so for me, it's not really about cost, it's about politics and what our priorities are. And meanwhile, we are in a war, right? We're in a war. And, you know, my colleague has been trying to get audits for the Pentagon's budget. Like, we haven't had the audit of the Pentagon. We don't know how much money they're spending. And so, I think for me, it's more like, if in the defense industry, if they think it's important, they feel like it's worth investing in, that should be the attitude that we take towards people's health.
I could not agree more than that. Sorry.
Yeah, I'll chime in a little bit on this, and I'll just remind folks that from the public health perspective, we just had a lesson in what it means to cover some people and not cover other people. Number one, that was the pandemic. Number two, immigrants in our communities are still accessing healthcare and healthcare services. They're doing it in a minimum of two ways. They're getting extorted when they go to medical providers for direct services, or maybe extorted is not the right way to say it, but they're paying that full market price for the service upfront and on the nose. And the other thing that they do is go to our emergency rooms. And since that's not going to stop, people who are bleeding, people who are having emergencies are not going to stop using the public infrastructure that we've all underwritten. We need to figure out ways to provide those folks. And I would agree with Brittany insofar as part of the big challenge, part of the movement challenge here is to shift our thinking from cost to care. And once we're in the care model, then to figure out how we can constrain this. Because right now we're in the cure model, I guess, working to treat diseases rather than cure, or working to treat diseases rather than cure or prevent them. So we have to do all of those things, and immigrants are in our communities. Many of us are married to them. Many of us have them at our tables and in our lives and in our networks, and they deserve to have coverage too. We are, after all, the most wealthy and powerful country in the world right now, and perhaps the most wealthy country in the history of countries on the globe. So we have a responsibility to figure this out, I think.
And we're only focused on cost when it's like things that are focused on actually helping people. Like Brittany said, not when it comes to endless wars and, you know, tax cuts for rich folks and profitable corporations. It's like, that's the only time you hear about how we're going to pay for that is when it's to actually help people. And the truth of the matter is we're doing our healthcare system in the most inefficient way possible. We're spending like 2 to 3 times what every other developed country spends on their healthcare, and they have universal programs. We do not, and we have worse health outcomes. So we're not even getting a good return on our investment. We're spending way more than everybody else. Our system is completely broken right now. And there's a better way to do it and cover everyone. But you're right, like the cost shouldn't matter if it's actually, we want to actually give quality healthcare and put public health at the center of what we're doing. But it does matter to people, or at least they say, or they use it as an excuse. But even the financial, you know, the economic picture says doing it this way is much more expensive than what we could do if we have a universal system.
Thank you so much, Rebecca. I'm going to do one last call for any burning question, but I also want to respect our speaker's time. And if I don't hear or see a burning question, then I'm going to cede the floor to Reverend Eleanor to close us out and close our sacred space.
There was one, I answered one question on the chat, which was somebody had an idea about marketing to counter the ads, which I think is a great idea. And some people have done some work on that. As our movement gets bigger, hopefully that need's going to be filled. Maybe there's some folks on this call who have those skills that can help do it. But the second question was just about how hard it is to enroll in Medicare. And I'm guessing some of this is about choosing your private Medicare Advantage program. And like, this is just, you know, my generation loves to use the word neoliberalism. But this is the sort of the paradox of choice, right? You've got so many choices that you've got no choice at all. And I mean, the way to streamline it is to expand Medicare to include everybody, to improve it to include everything. And just, that's it. And like, and it's such a good thing to bring up this issue with the just choice as a horror show, really, not as a good thing, because so the first of these industry letters about Medicare Advantage just came out, the one for the Senate, and the language they doubled down on is this is about choice. We want to have choice. And it's all about, everything you read about is, oh, we just need to educate people on making the right choices in life. And rather than, you know, which puts the burden on the individual, so that if it turns out that you're getting denials in care, it's because you chose the wrong plan. It's not because the system's broken. So yeah.
I was having a sound issue unexpectedly. And Amelia has made herself known as having a burning question. So Emily or Amelie?
It's Amelie. Yeah, actually, should I just do the sound without the, I don't know.
Just ask your question because we're really tight on time. Thanks.
Okay, so this is really actually a change of topic, and I just wanted to say, well, thank you all, and just take a few seconds to say that at our UU Church, I'm one of the many hats I wear is on the reparations task force. And so there's a lot of talk about being disenfranchised in different ways. And we are going to be showing a film on February 24th. And I just wanted to let you all know it's a documentary called A Story of Bones. That if you're interested, I can pass the information to you.
Thank you so much. And with that, Reverend Eleanor, are you still with us or do we lose you?
Yes, I am. And can you hear me?
Yes, we can.
And I want to say thank you. Thank you to our speakers. Thank you to UUSJ. We would not be able to do this. We would not have a voice in Washington without UUSJ, and not just Pablo, especially Pablo, also Paulette and our board members and our volunteers. Without UUSJ, and I'm a donor, so please follow my lead. And personally, I love historians and organizers. And my burning questions will wait for another moment. I hope that the flame of the chalice will light all of our fires and keep us going tomorrow and the days ahead.
Thank you very much.